Recent changes at La Crosse's Juvenile Detention Center are meant to address a serious issue.
News 8's Sarah Tamer was at the facility today and now joins us with more on these changes.
The facility saw a spike of attempted suicides last year, 13 to be exact, which was twice as many in all of 2016. The facility's physical features played a big role in making it easier for those attempting suicide. The juvenile center looks different now, but staff tell me it doesn't end there.
A new look
space and furniture.
at La Crosse's Juvenile Detention Center
We replaced the desks,
has a bigger purpose,
not only more suicide proof.
intended to address suicide attempts among kids at the facility.
We've went to a little bit more evidence-based model, so each child has their own space, each child has their own room.
So far this year, there have been 5 suicide attempts in comparison to 13 last year.
Plexiglass over the bars.
The facility's superintendent David Steinberg says placing plexiglass over the bars removes the bars as a way to attempt suicide.
So you can't hang from them if you were so inclined to.
Last year, the beds looked like this, bunk style and metal. Now, the beds look a lot different.
State statute says steel or bricks and mortar bunks or beds. I petitioned the state DOC and was allowed a variance to use plastic.
Facility staff say these physical changes are important in addressing suicide attempts, but there's another key player.
Having that therapist that's here, hands-on, he's full-time just for our kids in our facility.
Mental health services at the detention center aim to tackle the problems before they turn into suicide attempts.
Both on an individual basis, focused on alcohol and drug abuse. The most important component is bringing those families in to really talk about it. So that change that's happening with our kids here in our facility, if we don't see that same change happening back in their homes, we're just, reliving the cycle over and over again.
A combination of change in the physical environment and access to a therapist makes Steinberg hopeful suicide attempts will continue to go down.
Everybody could always use more mental health services, but I think we're doing a really good job right now.
There are currently 13 juveniles in the facility and 4 staff members, making it about a 1-to-3 staff ratio. Steinberg says the facility also hired 5 more staff members, so there is now a total of 17 people who work with juveniles.
Thanks so much, Sarah. And all of these changes were made by the end of last year.